Hey guys, so we're going to go through a cervical traction technique. So Glenn, how we do this one?
So we've got Ben in the supine position, again really nice for particularly acute neck issues. If you think there's a discogenic component, it's really good for that as well. Obviously there's new IDD therapies that are becoming quite popular in London, which I think are essentially forms of traction, and they're getting quite good results and stuff now. Traction's fallen a little bit out of favour in the last probably 15 years, but still quite an effective treatment for symptom relief. I think if someone comes in and they're very, very sore and very acute, if you can offer them a treatment that will give them some symptomatic relief initially, I think it's worth knowing and being aware of that. So I'll start with my hands. I often use the belt, but I'll show you how you could do this with your hands. So I'm going to come under here, I'm going to hook underneath the bottom of the occiput. Just going to bring my other hand onto the base of Ben's chin, and then I'm going to just create a cephalad glide on the head here and create some traction within the cervical spine. I can hold that. Often the response you'll get, especially if they've got referred pain into the upper limb, is that pain will diminish or even disappear. The downside is often when you release it, it just comes straight back on. But if you do it for a period of time, so I'll often do 4 or 5 sets of 1 minute, then you get a carryover effect of reduced pain and symptoms in the client. If you don't want to spend all that time, as someone's got a heavy head, or if you're a smaller physio, you can use the belt. Yeah, so the belt's really, really useful for that. I take it into this position, I cross it over, my hands go inside the belt, and now I'm going to come into that same position, but now the belt is going to hook around my hands, and from here I can just lean my body weight back. So my fingers are gripping under the occiput, very little force involved from myself in terms of my upper limbs. I can move my elbows, I'm not creating any tension from my neck, I'm just leaning my body weight back, and actually can generate more force this way because you're using your body weight rather than just your arms. So 2 really nice techniques there, variations on traction, which again, useful tool I think to have in your treatment box, because sometimes clients come in and they're just in so much pain, anything you can do to relieve it, even if it's short term, is a worthwhile exercise, particularly if you can then take them, offload them, advise them and educate them, as we do with all acute neck problems as well.
Yeah. Hope you enjoyed the video, guys. If you did, then please give us a like and subscribe by clicking up here. Also, don't forget to go over to strengthphysio.com and check out our members area, which has basically got our full library of all of our videos. You can get there by going to strengthphysio.com/members. Hopefully I'll see you on the site, and I'll talk to you all soon.